We're now going to look at assessment of the painful rear foot. It's important to ask the patient once again to try and identify the location of their symptoms. Patients may report pain on the lateral aspect of the rear foot, on the dorsal aspect of the rear foot, on the medial aspect, or on the inferior surface of the heel. We're going to cover some of the common pathologies that may occur in any of these regions. Starting on the lateral aspect of the rear foot, we've already covered peroneal tendinopathy as part of the ankle assessment. Subtalar joint arthritis may cause pain both laterally and also medially. Laterally, pain is often felt along the subtalar joint and also in the sinus tarsi. The easiest way to try and identify the sinus tarsi is to identify the calcaneal beak. This is the anterior prominence of the calcaneus, and having palpated the calcaneal beak, if you move superior and slightly posterior to that, you'll find a soft area which is the sinus tarsi. This is often inflamed in sinus tarsi syndrome, and it's also inflamed in subtalar joint arthritis. Firm palpation in this area will often induce symptoms. Pain on the dorsal aspect of the rear foot, a more globalised pain radiating right the way across, is nearly always talonavicular arthritis. Patients often believe that this is the ankle joint when they describe these symptoms, and it's very important that the patient points to the location of the symptoms. The ankle joint is more proximal, running across here. The talonavicular joint more distal, running right the way across from lateral all the way to the medial side. Firm palpation of the talonavicular joint can again induce symptoms, as can movement of the mid-tarsal joint that we discussed previously, holding the rear foot like so, the mid-tarsal joint, and rotational movements, frontal plane rotational movements of the talonavicular joint. Patients may also have symptoms affecting the anterior tibial tendon, and again stress testing of the anterior tibial tendon is important, as is stress testing of the extensor tendons, both the long extensor hallucis longus and also extensor digitorum longus. The superficial peroneal nerve, as it courses down over the front of the ankle, and we can clearly see the lateral branch here, may also become entrapped or irritated and give rise to neurogenic symptoms in this area. Moving to the medial side of the rear foot, subtalar arthritis, again this is going to be the medial side of the subtalar joint, and firm palpation along the course of this again may induce symptoms. Tibialis posterior tendinopathy, as we discussed previously, as the tendon courses around the medial aspect of the ankle, may cause symptoms. Firm palpation, resisted inversion will often induce those symptoms. Tarsal tunnel syndrome, as the nerve courses down and then separates into the medial plantar nerve, the lateral plantar nerve, and occasionally problems may associate with the medial calcaneal nerve in this vicinity. Tenderness in and around this area, neurogenic in nature, so paresthesia, burning, tingling sensation would be indicative of that. Pain on the underneath of the heel is undoubtedly one of the commonest complaints that you're likely to see when dealing with foot and ankle pathology. It's very important once again to try and locate the nature of these symptoms in order to try and arrive at an accurate diagnosis. Pain on the underneath of the heel in this area is most likely to be plantar fasciitis. Plantar fasciitis, meaning inflammation of the plantar fascia, may occur anywhere along the course of the plantar fascia, and remember that although it starts here in the heel, it runs right the way forward into the ball of the foot via three bands. The medial band that we can see here, the central band here, and the lateral band in this area. Tenderness may occur anywhere along the plantar fascia, but the two very common sites are in the medial band here and the central band, which tends to be more diffuse in nature, and moving more proximally, a more specific area of tenderness directly underneath the heel. To try and assess to see if this causes pain, it's important to first of all dorsiflex the foot, dorsiflex the toes. This puts the plantar fascia on stretch, and we can see the medial band there. Run your finger down the medial band with firm palpation. The same for the central band, and lastly the lateral band, although this is rarely involved. We then come to the heel area, and it's important again to locate the source of the symptoms. And you require firm palpation because you have to palpate through the fat pad, which on the average person is 1.5 centimetres thick. So as you can see, you require firm pressure to push through the plantar fascia, to push through the fat pad down to the plantar fascia to induce symptoms. Again, work your thumb around to try and locate where the area of tenderness is. Laterally, again, which is rare. Centrally, which is the most common area. And finally, medially. Pain which occurs on the medial border and the inferior medial border, so in this vicinity, is usually due to nerve entrapment of the lateral plantar nerve, or its branched abductor digiti quinti, or pain of the medial band of the plantar fascia as it comes down here. Firm palpation is very important to try and induce symptoms, and again, important to look into the history to see whether or not there are neurogenic symptoms in this area. It's also very important to appreciate that the two conditions often do coexist, giving mixed symptoms.